For our next interview, we're privileged to have Dr. Larry Lands. Dr. Lands is an associate professor of pediatrics at McGill University in Montreal and assistant director of respiratory medicine at Montreal's Children's Hospital.
Let me begin by congratulating you on the recent news that the Applied Journal of Physiology has accepted your research article on Immunocal for publication.
Thank you.
That's excellent news. Larry, for the benefit of all those on the call this evening, perhaps you could explain your hypothesis going into the Immunocal study and then what you examined before concluding with the data you generated and its significance.
We decided to take a look at the oxidative stress that occurs during exercise. We know that exercise is associated with a brief oxidative stress and that the level of glutathione provides protection against oxidative stress. And so we proposed that if we could use a product such as Immunocal that could provide precursors for the body to make more glutathione, that we could raise the body's level of glutathione and that we could improve exercise performance. So we performed what's called a double-blind, placebo-controlled study, which means that neither the subjects nor the investigators were aware on what the subjects were taking. And we had half our subjects take Immunocal and half our subjects take casein protein. So each group received the same amount of protein, but it was the quality and type of protein that they received. Now we studied healthy young adults. Most of these people were university students. And we studied them at the beginning and then 3 months later. At both times, we measured their glutathione levels in their white blood cells. And we also measured the amount of exercise that their leg muscles could do. And then we put them either on casein or Immunocal, and they were studied 3 months later. What we found was that in the Immunocal group, the level of glutathione increased in a significant portion, with an average for the whole group increase of about 35%. And we found that the muscular ability in the Immunocal group went up by 13%, whereas in the group who received the casein had no change in their glutathione level and no change in their muscular performance.
Larry, you also had some data which was very interesting as well, particularly the Immunocal group that you indicated performed 3 extra hours of activity per day over and above just the pure exercise, and then the increase in lean muscle mass. Maybe you could expand on that.
We didn't ask people per se to exercise more, but what we did is we provided them with a questionnaire of what their general activity was, which they scored on the percent of time they spent being moderate to very active. And what we found is that in the Immunocal group, the amount of time that they spent being active, where it didn't really change in the casein group, there was a tendency that whereas neither group's weight changed, the percent body fat went down in the Immunocal group, suggesting that they had kept the same weight but replaced some of the fat with what we presume is muscular tissue.
Very interesting. Okay, beyond the pure performance figures, many athletes, including myself, have noticed improved recovery, i.e. less muscle soreness after training. Do you have an explanation for this phenomenon?
Yes. The soreness that you get about a day after doing vigorous exercise, especially if it's an exercise that you're not used to doing, is caused by oxidative stress. So that if you could limit that stress by increasing the antioxidant protection, such as increasing glutathione levels, then you should limit the amount of muscle soreness. And it may be that people felt that they recovered faster afterwards, that they ended up doing more activity.
You recently submitted a case report about an individual with pulmonary fibrosis. Now, without naming, of course, the journal or the individual, maybe you could just touch on the testing design and the commensurate data you generated from that.
We studied an adult woman who had an obstructive lung disease of a variety of origins. She had had a history of smoking. She had also received chemotherapy for a lymphoma in the past. And what she was left was a decrease in lung function, which at times would respond to therapy with corticosteroids, prednisone basically. And she was having recurrent bouts of difficulty and having trouble whenever she came off her steroids. And so on her own initiative, she had started Immunocal, and she found that she had had a dramatic improvement in her own breathing, and when she was tested in the laboratory, her doctor, there was a dramatic improvement in her lung function. She was then convinced to try going off Immunical, and within about 3 months, she had an onset of her symptoms once again. And at that point, she contacted me, and I asked her if she would do me the favor of coming to our laboratory so that I could do a blood test for glutathione and measure her lung function. I said, you come back in 1 month, and we'll retest you. That way, you'll have some idea whether it did anything, both in your blood and whether your lung function. And so we did that. We found that, and I can't really give you a good explanation why, but her blood level of glutathione was very low to start with, well below normal levels. She also had marked lung disease on her lung function. After a month, her glutathione level went up quite a bit, almost to the normal level, and her lung function almost normalized. And this was really quite a dramatic change. And she since continues to take the product, and she feels really quite well, and she's free of taking steroids.
Very good. Larry, as a pediatrician, what is the incidence of childhood asthma you're currently seeing versus, let's say, historical data, and why do you think that figure is on the increase?
We certainly are seeing more asthma. We roughly about 1 child in 10 seems to have asthma or recurrent bronchitis. The origins of that are somewhat unclear. It may be partly related to pollution. I don't know what diet has to play as well, because certainly children are introduced at very young ages to foods that have additives that can cause allergies. There's less breastfeeding, which again seems to predispose children to developing asthma. But we certainly are seeing more incidence of asthma and more incidence of severe asthma.
What are the differences between the drug delivery systems such as NAC and OTC and Immunical?
NAC, which again can provide cysteine, and OTC, which can provide cysteine, have some difficulty getting into cells and being transformed and utilized in glutathione. Certainly, NAC has a lot of noxious side effects, flushing, tremor, nausea, headaches, where it's not the most efficient method of delivering cysteine. Where in Immunical, the cysteine appears to be in the form of what's called a dipeptide, or cysteine is linked with another amino acid, in this case glutamine, and it seems to be a very efficient way of getting cysteine into the cells where it can be used to make glutathione.
An issue that we deal with often at Immunitech is that of competitors using Dr. Bunos' data to promote their products. Now, as a scientist, could you explain to our audience the fundamental problem here, or maybe a better way of putting it is your research data that you've done on Immunical applicable to other whey proteins?
It would appear not, in that most commercial whey products are prepared with pasteurization, and it's the pasteurization process that causes the protein to change shape, because it's a rapid heating process, such that protein can no longer deliver up its cysteine groups, whereas the process of preparing Immunical only uses a very light pasteurization and mostly as an ultrafiltration method, so that while being sterile, it still preserves the nature of the protein.